Like she said, I'm a pediatrician over in the Dundee Clinic, which is about 52nd and Dodge, and I've been there about 4 years. And by all means, we'll have questions at the end. If you want to raise your hand because you have the question right when we're discussing it, I don't mind. It's pretty informal here. So what I did was I asked a lot of my friends, a lot of parents that I have within the clinic, what things would you wish someone had talked to you about or warned you about before the baby came, and that's kind of where I came up with a lot of my information, the most common questions I get in the clinic. So, and then of course we'll go over questions you guys have at the end too, so really informal. So this is one of my favorite pictures. Like she said, I'm a mommy of 3, and so a lot of my advice comes not only from my training, but also practical advice that I have as a mom of 3. And it seems like just yesterday, I was holding this newborn, and you kind of have that feeling of excitement, but nervousness because it's all brand new. And you'll find that you're going to get a lot of advice from family members, friends, and everyone has their own opinion about how to take care of this newborn. But you'll find your own way of doing things, and it's going to be your perfect way, although everyone has their own opinion. So. And now he's 9 years old. It just goes so fast, so you have to enjoy every day. So what I'm going to talk a little bit about is what things to get prepared for prior to delivery, what to expect immediately after delivery, what they're going to be doing within the room, what they'll be doing with the baby right after the baby has arrived. On the way home, so things like the car seat, what to do, preparing to place the car seat in the car and what to do there. The first few days, it's kind of crazy first few days because you'll not only be at home, but you'll be making visits to the doctor's office and what to expect there. And then the first few weeks after the baby's born, we'll talk a little bit about that. So before the big day, everyone's heard about nesting and getting prepared for the baby, and everyone has their own way of nesting. My husband claims I was the cleanest during my nesting period, and I'm probably not as clean as I was at that time, but the things to really think about, and you're probably already prepared, with baby showers and getting ready is, making sure you have where the baby's going to sleep, like the bassinet. It's really your personal preference. Some people like co-sleepers. Some people want to place the baby right in the crib, and there's really no right or wrong answer to that. And I find a lot of parents make the decision once the baby comes home because the baby kind of makes the decision. It's kind of the proximity really helps. If you're breastfeeding, you'll probably want to be real near the baby so you can hear or see the cues that the baby has as far as feeding before they start crying. But other people prefer to have them, in a crib and just have the monitor on. So there's really no right or wrong answer there. If you're breastfeeding, a lot of people go ahead and get the breast pump prior to the delivery. Now there's some people who wait, and I think that's fine too because it is an expensive purchase. But if you're going back to work, it might be something to think about just because you actually will be pumping even before you go to work to kind of prepare the milk supply before you go back. And we'll talk a little bit about that in a little bit. And then you've all seen the boppies, I'm sure. And that's kind of mostly for comfort reasons. If you're breastfeeding, it's a good positional placement of the baby for the breastfeeding. It's also a good place to have the baby if you're just holding the baby too. So that might be an option. And then the swaddler, which is another thing we'll talk about, which is really comforting to the baby as well. We talked about nesting, and one thing I've had a lot of moms say they wish they had done was making easy meals accessible, so freezing meals, having easy meals ready because you'll be doing a lot of other things, and cooking is not one of them probably. So once you know you're going to have this baby and you're in the hospital, and you're checking in, they're going to ask you who your pediatrician is. And so you don't have to worry about contacting the pediatrician. The staff at the hospital will do it. So once the baby's born, they call the pediatrician. And we usually try to get to the hospital within about 6 or 12 hours after the baby's born to check the baby out. And we're there every day, just like the OB is there to check you out. We're there every day to look at the baby. So you'll be seeing a lot of the pediatrician in the hospital. So once the baby's born, they'll probably place the baby on your chest if it's a vaginal delivery, and you're going to look at the baby quick, and then they have a warmer nearby that usually they'll take the baby to kind of wash the baby off. Am I off or on? No. I'll talk really loud. So they'll have the baby in the warmer, wash the baby off, take vitals, check the oxygen, the pulse, make sure that the baby has a good vigorous cry. And then while they're over in the warmer, oftentimes usually they place erythromycin drops, which is just drops into the eyes that prevents infection from the actual delivery itself. So for a few hours after delivery, the baby will have kind of droopy eyes, and then that goes away, and that's just kind of from the eye drops themselves. We usually do vitamin K injections, and that is mostly to make sure that we catch all the babies that might have a clotting problem at birth. And the thought behind that is babies need to have, because of the trauma from the delivery itself, with whether it be vaginal or C-section, oftentimes we want to make sure they're able to clot and not have significant bruising or bleeding. So most babies will produce clotting factors in their GI tract, but we don't know which ones do or don't, and that's why we give vitamin K injections right after birth to the babies. They'll ask you once you are admitted to the hospital whether or not you want to give a hepatitis B vaccine, and they obtain your consent for that. We used to give Hep B vaccines at 2 months of age, and now we're doing it right away after birth, and mostly just to protect the baby from the get-go. But if you have any questions about that, you sure can talk to the pediatrician, and they can go over things as well as far as the vaccine goes. They do initial blood sugar to make sure, because of the trauma of the delivery, make sure the baby's able to adjust the blood sugar immediately, and then after that we don't have to check any longer. So it's just an immediate blood sugar check after birth. The Nebraska newborn screen, I don't know if you guys have ever heard of that before. We obtain that screen at 24 hours of life, and they poke the heel of the baby, get a couple drops of blood, and it's a screen that we send that checks for numerous different types of amino acid disorders, thyroid, cystic fibrosis, hemoglobin problems, and it's a very broad screen. That screen usually takes a couple weeks to come back. So during one of your visits with your pediatrician, you'll be going over that screen at about 2 weeks of age. So it's a really good one. And then, of course, during that first few hours after delivery, we try to get the baby to the mom and dad as soon as we can, so you guys can get to know the baby and bond with the baby quickly. So that first day of life, the baby's often sleepy, and I usually walk in the room and the mom says, the baby's really been sleeping all day, had a really good feeding initially after birth. They're usually really wide awake and alert, and they usually take from the bottle or the breast pretty well, and then they kind of go into a sleepy phase, which as a new mom, I had a lot of adrenaline going, so I didn't want to sleep too. I kind of wanted to look at the baby and check things out, but you should try to sleep as much as you can when the baby sleeps. So they're real sleepy. You should try to breastfeed within the first 30 minutes after the baby's born. The same with the bottle. You should try to offer the bottle within about 30 to 60 minutes after the baby's born to try to get a good feed. And they're not going to take much initially. Usually it's just about a half to 1 ounce, which isn't very much. And one of the things I try to remind parents are their stomach is very, very small. So their stomach is about the size of a walnut, which usually is just about 1 or 2 teaspoons. It's not very much. So I know if you're breastfeeding, you feel like you're not giving a lot of breast milk initially, but you do have a lot of colostrum that's coming out. And you really, like I said, only need about 1 or 2 teaspoons of colostrum to really fill that tummy up. So don't worry about the amount you're giving them enough. And the other part of that is just monitoring how much the baby's peeing and pooping will give you a good idea if the baby's getting enough too. So like I said, the baby usually sleeps. You should try to sleep when the baby sleeps during that first day. The other thing that often happens, and it's kind of a surprise to parents too, and when you see it for the first time, it is kind of alarming. They often are kind of spitty, and a lot of it is they have stuff in their tummy that's left over from the delivery itself. So they may have a little bit of mucus that comes up, or even some of the colostrum, amniotic fluid from the delivery itself, and so they may spit up that a little bit. And the best thing to do is, just make sure they're upright, pat them good on their back, turn them to the side, and just kind of help them get that mucus out. But that's very, very common. We like to have babies have an initial poop within that first 24 hours of life, and sometimes it can be longer than that, but that's usually our goal, 1 poop for that first 24 hours. And I don't know if you guys have ever heard of meconium, but that's the initial poop that the babies have. Yes, us pediatricians talk about poop a lot. You'll find out, yeah. And meconium is that thick, it's really thick tar, tarry stool. And so I always call it the one package wipe stool because you will literally use a whole package of wipes to get it gone. There's so much there. But after that, as soon as they start getting more of the milk or formula, you'll notice it kind of transitioning into more of like a greenish stool, easier to wipe up, and then it becomes a real yellow, seedy stool. You never thought you'd talk about stools this much until you have a baby, because you'll be changing these poos. So yeah, it becomes yellow, seedy, and like I said, one stool that first day and one wet that first day is usually our goal, and that reassures us that they're getting enough food-wise. So I always try to emphasize, it's good to have the baby go to the nursery if you are really tired and you feel just overly exhausted. It's always good to have a break. But oftentimes rooming in, and most hospitals will have rooming in where the baby will stay with you. And the best thing about that is if you're breastfeeding and if you're bottle feeding, you can kind of watch the cues of the baby. And you'll notice the baby, when they're hungry, they're not really going to actually have like a cry. They're more going to be doing a rooting where they're kind of looking for the bottle with their mouth, or they're bringing their hand to their mouth, and you'll know that that's probably when they're hungry. So the best time to do that is, when they're right there beside you, you can really get their cue really quickly, feed them before they actually cry. Sometimes if they go to the point of no return and they're crying so hard, then they won't feed very well. So that's why we usually have you room in the baby as much as possible, just so you can really get to know them that way. Swaddling, holding the baby makes them feel like they're still within the womb. They do not like to be exposed. They don't like to have their arms and legs flailing. That's why we really swaddle them and keep them nice and tight after the baby is born. And they do familiarize with voices. So they've been hearing these voices for 9 months, and now they're with you, and they like to be near you. So it's really calming to them to have you nearby. So that second day of life, I wish someone had kind of warned me about the second day when I had my first one, because it's not a horrible day. It's really exciting and fun, but they just wake up more, and they're a little bit more fussy, only because they're kind of trying to take in their outside world and take in all the stimuli that's around them. So oftentimes at this stage, they will do cluster feeding, and cluster feeding is, they're not usually doing that every 2 to 3 hours of feed. They're kind of feeding every half hour to hour to 2 hours. So you feel like you're feeding them a lot. And so a lot of us mommies think, okay, they're feeding frequently because they're not getting enough milk, either breastfeeding-wise or bottle-wise. And oftentimes that's not the case. They oftentimes are doing that just because they're more awake and they're more alert and ready to feed more frequently. It doesn't last long, I promise. I want to reassure you it's not going to be something that goes on forever, but usually within the 2 to 4 day range, they oftentimes will do cluster feeding. And if they're not cluster feeding, just continue to feed every 2 to 3 hours. So if you are deciding to breastfeed, really the frequency of the feeds really determines when your milk comes in and how much of that milk comes in. And without boring you too much, I want to reassure you, if you're doing the cluster feeding with breastfeeding, oftentimes it's laying down good receptors in your breast so that more milk will come in, and it will come in at a sooner interval. So although cluster feeding is very tiresome, it will help with the breastfeeding process overall. It will increase your milk supply, and when the milk does come in about day 3 or 4, you'll have plenty of milk for the baby. If you're bottle feeding, like I said, just a half to 1 ounce at a time is usually all they need. If they're still fussing after that 1 ounce, then it might be that baby that wants just a little bit more. Like I said, the second day of life, we mistaken it for them being so hungry, not getting enough. They latch on frequently, and once again, don't worry, this will pass in time. They'll just do the cluster feeding for a little bit. And I think during this period, if they just are not satisfied as much, just make sure you're swaddling them. And then skin to skin is often helpful. That's really calming to babies if they're skin to skin with dad or mom, whichever. So that's a good technique to try. And like I said, I won't go over it too much, but reorganization of the overstimulated nervous system that they have just from the delivery process itself. New sensory input, there's lights, there's noise around them, so try to make the room as quiet as possible just to calm them. And they just need to be near you. They like to hear your heartbeat and feel familiarity with you. Any questions at all? Okay. All right. So that day 3 to 5, this is kind of the going home period, and that's usually when the milk is coming in if you're breastfeeding. I always try to warn moms too. Sometimes it'll be delayed if you have gestational diabetes, or if you have a cesarean section. Sometimes it takes a little bit longer, but no worries, it will come in. And the other thing is, if you don't have pretty consistent, frequent feedings, meaning every 2 to 3 hours, sometimes that will delay the milk coming in too. But usually the last day I see the baby and the mom, I usually try to predict that night when you go home, your milk will come in, or the next morning. And these are the reasons why you feel like you're coming into the clinic a lot, because you'll probably go to the clinic within the first day or two after you go home, just to make sure that the weight is still good and that the milk has come in and the baby's still doing well with the breastfeeding. One way you'll know if your milk is coming in, some women will say they feel the letdown, they feel engorgement, others will not feel it at all, but they will hear more of the swallowing of the baby. You can hear them actually swallowing the milk, or I call it the milk mustache. You'll start seeing milk right around their mouth, and you'll know that it's truly in. And the colostrum is more like a yellowish color, and then when it goes to the mature milk, it'll become more of the milk, white milk that you usually see. And then we already talked about the stool transition. So that's another confirmation that your milk is coming in, because the stools will be yellow seedy stools. And then that's usually the time when breastfeeding jaundice can occur. And I don't know if you guys have ever heard of jaundice, but that's kind of the yellowing of the skin. And I would say the majority of the babies I see do develop jaundice. It's pretty common, both bottle and breastfed babies. I'm just going to talk a little bit about breastfeeding jaundice, or jaundice in general. It's caused by increased deposits of bilirubin, and bilirubin is just what all of us produce in our body. But in babies, there's several factors that cause the bilirubin to be deposited in the skin and the eyes. So they usually have really yellow eyes and kind of a yellowish color to them. Oftentimes in babies, they'll start with jaundice at the head, and then the higher the jaundice level, it kind of goes down to the feet. So it can kind of tell you how high the jaundice is. If there's any bruising from the delivery, oftentimes in order for the body to get rid of the bruising, it breaks down those red blood cells from the bruise, and then that causes higher jaundice level in babies. Or if the liver hasn't kicked in, which usually takes a few days for babies, the liver is required to really help get the jaundice down. And then if you have a baby that doesn't stool very much, so if you have a baby that goes a full day without a poop, then usually they'll have higher jaundice too, because the only way you'll get jaundice down is by stooling out the jaundice. So those are usually the big factors in what causes babies to be jaundiced. So jaundice usually peaks about day 4 or 5, and that's usually the time when you'll go into the clinic too. We do a lot of jaundice checks in the clinic. But most hospitals will check the jaundice level before you go home. It depends on what hospital you go to, but I would say a majority of the hospitals will have what we call transcutaneous, where they take this little handheld machine and they shine the light on the forehead, and without poking or drawing blood, they can kind of get a guesstimate of what the jaundice level is. And then if that's high, then we may have to poke, and get a serum level or a blood level of it. But most of them we can check just with the transcutaneous. Like I said, stooling decreases the level, which is very helpful. And feeding well will decrease the level of jaundice too, because the more you feed, the more they're going to have stools. So that will decrease your jaundice. And like I said, you'll probably follow up in a day or two after you leave the hospital, because of the jaundice issues and weight too. We already kind of talked about this, about the Spitty Baby. The stomach is so small. But I always try to point out, it's very, very commonly the very upper portion of the stomach, where the esophagus kind of goes into the stomach. In newborn babies, it's really floppy. It's not very firm. And so minutes after a feed, or even up to hours after you feed a baby, oftentimes the milk will come back up the esophagus. And it's very normal, except in babies who are not gaining weight very well, or if they're really fussy. Over time, and I would say, at the 1 month mark or so, sometimes that reflux will cause acid to kind of burn their esophagus, and so that's when they become fussy. And that's something you could talk about with your pediatrician. But for the baby that's not fussy, gaining weight well, oftentimes they will be a little spitty. Now, burping usually helps a little bit with the spittiness, but not always. Some babies will just be spitty no matter what. So I think the other thing I want to point out is the only time to be really alarmed where you call the hospital or you call the clinic is if the spit up is like a bright yellow. That's not normal, or blood. Of course you'd call. But other than that, spit up is very common. You just have a lot of laundry to do is the only problem. So one of the techniques we usually try to tell you is, keep the baby upright, at a 45 or 90 degree angle after feeds, because laying them down oftentimes makes the milk come up faster too. But I will tell you truthfully, in the middle of the night, I'm not going to keep a baby up for 20 minutes. If the baby's asleep, it's hard to keep them upright. But as much as you can, keep them upright. And then in the babies that are really spitty, oftentimes trying smaller amounts more frequently. So if you're bottle feeding them, giving them 2 ounces at a time every couple hours instead of 3 or 4 every 3 or 4 hours might help with the spittiness too. So right before you go home, we'll make sure we check the weight. And it's very common for babies to lose weight after they're born, and mostly because they lose a lot of fluid just from the delivery itself. Swimming around in your belly for a while, they accumulate fluid in their skin. And so they usually lose some weight initially after the baby's born. So we just check that. And our cutoff is about 10%. So they've lost more than 10%, then we usually really follow you closely and have you come in sooner than later to the clinic. Most hospitals now, I think all will have lactation consultants. So if you're breastfeeding, you can always try to find them before you go home. They usually come into the room and observe a feeding, give you some advice. And I always say if you can, get them to come in at least once. It's really helpful just to reassure you that the breastfeeding's going okay. And then your pediatrician will kind of determine when you come into the clinic next. So you can talk about that before you guys go home. So if you're having a boy and you want to have the baby circumcised, we usually try to do that about 24 to 48 hours after you guys get there. And we usually want to make sure that the baby has peed at least once, and that's mostly to make sure the plumbing's okay before we do the circumcision. Usually the OB or the pediatrician will do it, depending on if the pediatrician wants to do it. Oftentimes the OB will do it instead. After the circumcision is done, the nurses and the physicians will kind of show you how to take care of it. It's pretty easy. A lot of it is just protecting the area from rubbing up against the diaper. So we usually have you put Vaseline to the site for about a week or so. And I always try to warn you too, when the circumcision is healing, oftentimes it's kind of a yellowish color, which sounds strange, but it's just the natural healing of it. And it often looks like baby poop, so it looks like that yellow seedy stuff. So I always just say leave the area alone, and usually the healing of the circumcision will take place over 7 to 10 days, and then you don't have to worry about doing the Vaseline anymore. So going home, one of the best advice I could give you about the car seat. I mean, it's so confusing out there because there's so many car seats and so many new changes in our recommendations. But usually with that base, I usually suggest maybe having someone that's certified in placing bases do it the initial time. And there are some car dealerships in town that have certified car placement tech that will do it for you. And I know I did that with my first child because I just wasn't sure about how to place it. And then the Safety Council of Omaha also has dates that they will help you place the base. And I think once you place the base the first time and see someone else do it, it gets much easier subsequently after that. But I would have that placed if you can before that. And then there's a couple differences. I'm sure you all have or are going to get the infant rear facing. And the newest changes in the recommendations are, we used to say they have to face back until they're 1 year of age and 20 pounds. Now, the newest studies have shown that even kids between 1 and 2 years of age really don't have the neck strength if they were in a car accident to be able to protect their neck and spine. So now we say 2 years, which seems like a long time, but keeping them rear facing until 2 and 20 pounds is the newest recommendations. So you're going to run into the problem between 1 and 2 where they probably have outgrown the carrier, if you know what I mean, the infant rear facing, and that's when you'll go to a convertible, and that's just the seat that you will use when you eventually just turn them facing forward, if that makes sense. But each car seat's different, so you kind of have to go off the recommendations of each car seat, recommendations on the when you purchase it. So, and then your pediatrician can go over that with you too at visits. So you're finally home. I don't know if you have pets, but one of the most common questions I get is how do you introduce the baby to the pet, or vice versa. It would be the pet to the baby probably. And you've probably heard the technique, and I think it is probably the best one, is use a blanket that the baby has already been swaddled in so they have the smell, and you can introduce it to the dog or the cat, probably the dog. And that's a good introduction. Most pets do just fine, though. It's never usually an issue with a newborn. If you get help offered to you, you should take it as much as you can. One of the things, if you have a lot of out-of-town visitors or a lot of friends that want to come over to see the baby, you have to make sure you kind of limit the time that they are over. So frequent visits at short intervals are probably good. And then turn off the ringer. That's what I had to do, just because you're going to be so busy with other things. So call people back at later times if need be. So, trying to prepare for the nighttime feeds is good. Having the baby in the bassinet next to you is helpful within reach, so you can get to them quick for the numerous nighttime feeds. Having bottles ready if you're formula fed is often good. Having it measured out and just adding the water as needed will help with the nighttime as well. Moms often forget to eat because they're so busy, so don't forget to eat, especially if you're breastfeeding. Sleep when the baby sleeps. And one of the best advice I could give to new moms and dads is, try to take a break. I think the first couple weeks is like a whirlwind, and being able to get out of the house to do something often will mentally help you, get through this little marathon that you'll be going through. So for me, it was just a trip to Target. That's all I wanted, just a trip to Target, and that's what I did. It's your little outing, Burping, we kind of already talked about, and it seems a little self-explanatory, but there are some babies that will burp really well. They'll burp within a couple minutes after you prop them up and pat their back. Others will not burp, and so it's the ones that don't burp that sometimes are a little bit gassy, maybe a little bit fussy. I always say, give it a good 5 to 10 minutes. If they don't burp, then, don't worry. A lot of times being upright against your shoulder will help. The other position that I like too is while they're awake, having them laying down on your arm, so face down, where you're kind of cradling their head right here with their bottom up, and you just kind of pat their back. And that kind of brings up burps too, or toots, whichever end the gas will come out. But that will help, the football position is what I call it, kind of face down. Swaddling, I always laugh because there's nobody that can do swaddling like nurses in the hospital. I've tried to replicate, it cannot be done. The nurses will show you in the hospital how to do the swaddling, and it's really nice because they do feel the comfort of being really tightly wrapped up. Pacifier use, that's usually one of the questions I get a lot from parents, and I think it's a little controversial depending on who you talk to. I think if you're breastfeeding and the breastfeeding is going fine and you're not having problems with the latch, then I think pacifiers are fine. I don't think it's a big deal. I think sometimes babies, when they breastfeed, sometimes will latch on for long periods of time and use mom as a pacifier. And if you're getting sore and you're really having problems soreness-wise, I think pacifiers can really help. And I think overall, I've used pacifiers with all 3 of my kids because it can be a lifesaver. So I'm one of those that doesn't really mind them, but I think getting the breastfeeding going first is probably the most beneficial. Other ways to keep the baby happy. Some babies just like motion, some don't. So having a swing oftentimes will be very calming to some babies, some hate it. So the bouncy chairs, the vibrating chairs sometimes can be helpful. Like I said, the swing may be helpful. Some babies enjoy white noise, so like the vacuum, if they're really fussy, that can calm them. And then the other technique too is, as you have them swaddled in your arms with a swaying motion, so you're doing all this at once. They love the shh, 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 shh noise. So I spent many an hour doing the shh, shh, shh right in their ear, and that was really calming to babies too. So just some ideas to keep the baby happy. I always get questions about bath time and how often should you bathe a baby, and the nurses kind of go over this with you in the hospital, but really babies don't need to be bathed more than a couple times a week, which sounds really kind of odd because you think, new babies need to be bathed a lot, but initially when the baby comes out, they will be real peely, like they'll have a lot of skin peeling, and that's mostly from just being in your belly for so long, swimming in that amniotic fluid. And after a couple weeks, you'll notice the peeling kind of going away. Bath time, like I said, 1 to 2 times a week is all you need. I mean, you can do it more frequently if you want to, but you don't have to. Lotion often helps with that peely skin, but oftentimes it just takes time before the peeling goes away. The other thing that's kind of changed over the last few years is we used to tell parents to put alcohol on that umbilical cord to prevent it from getting infected, so that umbilical cord will stay on for a week or 2 after delivery, and then it falls off on its own. Nowadays, we tell you the less you do with the umbilical cord, the better, and the faster it will fall off. And the thought behind that is you kind of have natural bacteria on your skin that will help make the cord fall off faster. So the less you do with the umbilical cord, the better. Like I said, it usually falls off between 1 and 2 weeks. The only thing we tell you is just watch for any redness or pink areas around that umbilical cord that might be signs of infection, but most often they do fine. So the first few days, schedules are really difficult to set. Days and nights are often mixed up. My best advice, if you have a baby that has days and nights mixed up, is don't let the baby sleep more than 3 hours during the day, which is sometimes hard if you've been up all night and the baby's finally gone to sleep. But I'd probably try to wake them up to feed, but also to keep them or help them switch to nighttime sleeping by not letting them sleep more than 3 hours during the day. You'll go into the pediatrician, like I said, milk comes in, and you'll notice that the baby will start stooling more frequently, which is very normal. And around this time, about 2 to 4 days of age, you'll notice they'll probably stool with every feed. So they stool every 2 or 3 hours or so. Weight gain, usually a baby will gain about ½ an ounce to 1 ounce a day is kind of our goal. We want them to be back up to birth weight by 2 weeks of age, and most do that just fine. And I usually say, waking the baby to feed every 2 to 3 hours is a good goal for that first 2 weeks. And then if they're back up to birth weight by 2 weeks, then you can let them sleep. I probably wouldn't let them sleep more than 5 or 6 hours, but if they're a really good sleeper and they want to sleep more than 3 hours, they're back up to birth weight, that's okay. That's okay to do. But keeping them feeding every 2 to 3 hours will help with the jaundice. And I just told you the other part. They can sleep longer if they're back up to birth weight. Any questions at all? All right, you guys. You'll hear a little bit about vitamin D supplement, and we've been doing this in babies that are exclusively breastfed. It's a recommendation of the American Academy of Pediatrics, and the reason behind it is we used to think there was enough vitamin D that went through mother's milk, but then we had some babies that were developing rickets or bone disease. So now we give supplementation to the baby, and it's just once a day, 1 milliliter a day. I always say it's kind of poorly tolerated because it's kind of like the prenatal vitamin in the liquid form. It really smells awful. You almost feel mean giving it to the baby. But I usually say give them the milliliter and then latch the baby right on, and usually they forget about it. But that's the only vitamin they really need during breastfeeding is the vitamin D. If you're doing breastfeeding and you're supplementing with formula, we recommend doing the supplementation of vitamin D unless you're giving them at least about 27 ounces of the formula per day with the breastfeeding. So you might get enough of the formula to not need to do that. So a lot more wakeful. They'll start focusing with their eyes within the first few weeks on your face, and it's just for a few seconds at a time. They'll start lifting their head kind of to a 45-degree angle, and that's a good time to actually start doing tummy time. And the thought behind tummy time while they're awake is to kind of strengthen their neck muscles, and it's a good way to prevent SIDS. If they happen to get their face caught in something, they would be able to kind of lift their head out of wherever they are. So giving them tummy time will really help strengthen their neck muscles. They'll startle to loud noise, and that's kind of one of the questions I always ask newborn parents to kind of assess for their hearing. If they hear something loud, they'll startle to it. I get a lot of questions about when can we leave the house? Is it okay to leave the house? What temperature can I leave the house with the baby? And I think it's really good to get out and really, base your comfort level, or the comfort level of the baby on your comfort level. So if you're feeling too hot outside, it probably is too hot for the baby too. Layer the baby just like you would yourself. So if you have 2 layers on, the baby should have a couple layers on too. The biggest thing and then that kind of goes along with the temperature in the house. Parents ask me all the time what to set the temperature in the house at, and I just, you really just base it on how comfortable you as parents are in the house. The biggest thing is when you're out and about, making sure whoever touches the baby washes their hands. And coming into the fall, winter season, that's super important. The reason behind that is, a simple cold in an adult is a pretty big deal in a newborn baby, because oftentimes they'll spike fevers with even a simple cold. Anytime a newborn gets a fever, that's kind of an automatic. We've got to, go to the hospital and make sure things are okay with the baby. So anytime anyone's sick, they should probably stay away from the baby, and then washing the hands before touching is the most important. So that's why I love the baby carriers, because parents can go out and about and show off the baby, but they're kind of protected within the carrier. So they can see the baby, but not really touch the baby is often a really good way to do it. Travel. I think travel is fine. Usually babies, early on travel really well, but it kind of goes along the same line of exposure to illnesses out there. So try to keep the baby covered, protected away from others as much as you can. I've kind of gone over all this, washing hands, and then developing fevers. They need to be seen right away by a physician. When can the baby go outside? They can go outside as long as the temperature is fine. We don't really recommend sunscreen under age 6, so it's 6 months of age. So it's a lot of covering the exposed areas. Big hats are really good, but it's okay to go out as long as it's cool and they're really well covered. And really the temperature tolerance is based on how the parents feel, like I said. If there's any older siblings, their adjustment to the new baby really depends on the age of the baby, or age of the sibling, excuse me. If the sibling is young, under 2 years of age, oftentimes they won't even acknowledge the baby, or they'll kind of give the baby a kiss and then go on their way and play. If they're older, oftentimes they are very maternal or paternal, and they really want to help with the baby. So I think just the slower the introduction, the better. And I think the biggest thing, too, is if there's other siblings in the house, make sure you have some special time with the parent and that sibling so they feel special themselves. So an outing with that sibling, so they know that they're still important, too, is pretty important. So that 2-week visit is a big visit, weight check. That's usually when we look at the jaundice, make sure that that's all resolved, and then we go through that newborn screen that we talked about at the beginning. We also look at the circumcision site, the umbilical site, make sure that all looks okay. We discuss the vitamin D supplementation. And then my biggest thing is I always try to address any signs or symptoms of postpartum depression. And it doesn't happen very often, but if you ever feel like you're having the blues or sad or teary following the delivery, it's really good that you talk with your OB or your pediatrician, because you'll probably see your pediatrician more than your OB. I doubt that's going to happen to anyone here, but I always just like to throw that out because it's such a big life-changing event. And like it says here, it's a new experience. You have different hormones going through your body, and if you're ever feeling that way, don't be afraid to talk to your pediatrician, your OB. So if you are going back to work, some of the things I try to talk with my mommies about in the first couple weeks is getting prepared to go back. And sometimes mentally it helps to go and visit the place that the baby will go, whether it's daycare or family home, and just kind of have an adjustment day. So when you do go back that first day, it's not quite so traumatic for mom. Usually when you return to work, it depends on how long you're off. You may be in a routine, you may not, but most places, daycare-wise, are kind of used to babies at this age not being in a routine, so don't worry about that. I usually say if you are breastfeeding and you want to start saving up milk, the best time to do that is after about 2 weeks, once the breastfeeding is established. And the best way to start preparing to go back and saving up milk is just pumping 1 or 2 times after you breastfeed the baby. And that will kind of start a storage up in your freezer for when you go back. And then in your handout, I won't go over this, but it kind of talks about storing breast milk, and that will be helpful to you once you get there. And it depends on what type of freezer you have, as far as how long you can store it. You are able to do vaccinations before you go back to work, and if you're going to vaccinate your child, I would recommend probably doing that, mostly because of the exposure, especially if they go to a daycare. You can do vaccinations as early as 6 weeks of age. Most of us do it about 2 months, so 8 weeks. So it really depends on your comfort level. But we do about 3 or 4 vaccines that first at the 2-month healthcare care maintenance. And then once you go back to work, just make sure you're trying to, it's easier said than done when you're in the work atmosphere, but trying to pump at the same interval as the baby feeds, and that will keep up your supply as much as you can. And you can combine milk from separate pumping sessions. So over the course of the day, you can put all the milk into one bottle for them to have the next day. That's no problem. So my last subject is, when do I call the doctor? And I think the most, blanket statement is whenever you feel uncomfortable about a situation or concerned about the baby. But whenever you notice the feeds are not going as well, the baby's not waking to feed every 2 to 3 hours as they usually have been, that would be a reason to call. If they haven't stooled in the last 24 hours, or if they haven't had a wet every 8 hours. So we like to have at least 3 wets a day is kind of the baseline. If there's an unusual color to the stool, like blood or mucus, would be a time. Fever is greater than 100.4. If they're just extremely fussy and inconsolable, that's a time to call. And like I said, whenever you're feeling unsure about anything, please call. Most pediatric clinics, such as ours, have after hours, so where you call the main phone number, and in the middle of the night, you'll get a triage nurse that can go over things with you if you have any questions. And then one of the docs is on call that can go over things with you too as well. So there's always someone out there to talk to, even in the middle of the night, if you have any questions. So, do you guys have any questions? No questions, dumb. Yeah.
I had a question as far as the umbilical cord, as far as protecting it. Is there anything you need to do there when the baby's first born?
A lot of times what we do is we kind of, with the diaper, we kind of tuck the diaper underneath so it's not rubbing up against the umbilical cord, right? And usually that kind of protects it. Now, I would say 9 times out of 10, I get phone calls from parents because taking off the onesie will kind of pull on the umbilical cord, and then you may get a little bit of bleeding. Now, that being said, you really have no nerve fibers near that umbilicus, so there's really no pain associated with the umbilicus. It's more traumatic for parents because you're seeing some blood drops. But no, other than tucking the diaper in, there's really nothing else you can do, and then it just kind of falls off naturally. Good question. Yeah.
Suggestions for SIDS, because things have really changed a lot, and suggestions on keeping the baby safe.
Yeah, the question is suggestions on SIDS, and the biggest one is, of course, placing the baby on the back and making sure they sleep on the back. There have been some great studies that have shown that having the baby nearby you during the middle of the night actually is very protective of SIDS, only because you'll find out you're going to hear every noise possible that the baby makes, and so they think that the rhythm of your breathing oftentimes correlates with the rhythm of the baby's breathing if they're nearby you. And so you, like I said, will hear everything, and that's very protective. Not allowing anyone to smoke around the baby, that's the #1 cause of SIDS. And even if they smoke outside and they still have the shirt on, making sure they change the shirt, that will protect against SIDS. They've actually shown that pacifier use is actually protecting against SIDS. Not that I'm saying you should go out and make this baby have a pacifier, but that kind of actually triggers them to kind of breathe a little bit more through their nose, which protects them as well. Other than that, it's mostly just lay them on their back. And then, having nothing in the crib. That's the other thing, nothing in the crib. And so it's really tempting. You get all these new stuffed animals and fun blankets. And really, a baby doesn't need much in the crib at all. Bumpers, you really shouldn't do bumpers. And I know with my first one, I did bumpers, and then the recommendations have kind of changed as far as bumpers, because if the baby gets their face caught in a bumper, it could cause suffocation as well. And then the sleep sacks. I'm not telling you all to go out and get a sleep sack, but that's actually protectant too. It kind of keeps them on their back. It zips from the neck down to the feet, and it really protects them as well. Can't think of anything else. Yeah.
I just had a clarification from what you just said about the pacifier. Are you talking about pacifier use throughout the day, or just when you put them to bed?
To bed. That's a good question. Yeah, to bed. that's kind of hard because of the first few days they're always asleep. But yeah, to bed is all day long sometimes. But yeah, just the bed part. Yeah. Well, it was so nice to come out and talk to you guys. If you guys ever have any further questions, you can always get a hold of me. I'm at the Dundee Clinic. And congratulations, I'm excited for you guys. It's an exciting time for you all. So I'll be here for a few minutes if you guys want to come down and ask questions too. All right, you guys, thank you.
Thank you.